All right, so our theme, the key objective of our theme is to develop methodologies for assessing pandemic vaccine coverage, including isolated communities and cohorts of concern, such as healthcare workers and age cohorts. So typically, how is vaccine coverage assessed? Typically we use things like telephone surveys, but the problem with telephone surveys is that they cost a lot of money. They take time, and you don't get a whole lot of granularity in the coverage estimates that you get. So we decided to focus on, if we just did a better job of collecting the data as we're vaccinating people, then we can get coverage assessments, and you can use that data for all sorts of other things. So what our theme has been focused on is, looking at how data, immunization data have been collected, and how we can do a better job of collecting that so that we can have electronic data at the individual level. And I'm presenting on behalf of a large theme group. We've got a long list of investigators here, so everyone really contributed to the large number of projects that we've been doing. We've got an excellent team of research associates and a project manager, and we've got Stephanie Bryan, who's our graduate student. So the first project I'm going to be talking about is a study that we did to look at perceptions of immunization information systems, as well as individual level data. So the objective was to explore the perceived benefits and the benefits of and the barriers to immunization information systems, as well as individual level data. And so what we did was we interviewed 29 members of the public health community. So these included program planners, policymakers, and public health decision makers across the country. And so the perceived benefits of IISs and for collecting ILD, individual level data, were for vaccine program evaluation, for rapid analysis and reporting, and also for care management of the patient. Some features of an optimal system included system flexibility, so can it adapt to changes in data requirements, being able to capture the data rapidly and be able to report on the results. And then also universal application, so being able to be used across various settings where vaccines are provided. Some barriers to implementation that we identified included resources. So these included both financial resources and also human resource issues. So do we have the IT staff to implement these sorts of systems? Also privacy and security were concerns. And then also poor data sharing between vaccine providers. So you can have multiple systems, but if they're not communicating with one another, then it's very hard to get vaccine coverage estimates. So in conclusion, this study found that IISs were perceived as valuable by the key informants in terms of strengthening management capacity and improving evaluation of both seasonal and pandemic vaccine campaigns. But also certain barriers will need to be overcome in order to implement these more widely. And in follow-up, during the pandemic, we did a pan-Canadian assessment of the pandemic immunization data collection. So we did a comparison of electronic and hybrid systems based on the time spent by frontline staff for collecting data, the perceptions of the users of these systems, and then the costs. So just a brief slide on definitions. So electronic immunization data collection system, what I'm talking about here is where we have a system where all steps are done electronically. So from inputting the client demographics to medical history and vaccine administration data. So they're all done electronically at the point of care. And hybrid immunization data collection systems means where it's a system that combines both paper-based and electronic components. So it's typically we have a paper-based data collection, and then you do data entry into an electronic system, or there could be an electronic component at the client registration step, or done post-vaccination. So.